actual recording. God, it's not that great.
All right.
It's good enough. All right. So anyways, let's start with a normal everyday chest pain patient. And I'm going to go quick so I don't waste a lot of your video. So I'm going to start with 6 things. The same 6 things I start here are also in your trauma, so the best thing to do is memorize them. So BSI, is my scene safe? I see I have 1 patient. This looks like a nature of illness, not a mechanism of injury. I'm going to call for additional help, and because this is a medical patient, I feel like this is not a cervical problem. So there's my 6. All right. The next thing I'm going to do is I'm going to say 1 sentence, and it's going to cover the next 3 points. My general impression is I have an alert female whose chief complaint is chest pain. So now I just knocked out 3 points by saying 1 sentence. So now I've done 9 points, and I haven't even walked up to the patient yet. A quarter of my test is already done, right? All right, so meanwhile, hi, how are you?
I'm good, how are you?
I'm good, thanks. So that in itself tells me that she has an airway. I don't think I need an airway adjunct at this time. Next I'm going to assess some breathing. So as I look at her, I see A, the patient is breathing. B, it looks like she's breathing adequately, but I'm going to consider some oxygenation. So I would put her on a pulse ox, right? I put her on a pulse ox, and let's say that it reads 94%. I know that 94% is considered hypoxia, so that would be appropriate oxygen therapy to put somebody on a nasal cannula, 2 liters a minute. So I hook her up to a nasal cannula, 2 liters a minute on oxygen. So now I have her airway, I have her breathing, I'm going to check for circulation. So I'm going to check for her pulse, and I notice that her pulse is 98, strong and regular. I notice that she has no active bleeding anywhere, no major bleeding, and I notice that her skin color and temperature and condition is pink, warm, and dry. All right, so I've fixed all the things that can possibly kill her right now, and the things that can kill her are things with your airway, breathing, and circulation, just like in trauma. All right, so I can make a transport decision at this time. I think it's time that we should go get her chest pain checked out, and so we'll load her up on the cot, and I'm going to ask her all of her OPQRST and sample questions. So, ma'am, when did this pain begin?
Like 20 minutes ago.
All right, does anything make your pain better or worse? All right, can you describe the pain to me?
It feels like a tight feeling in my chest.
All right, does your pain radiate anywhere?
It radiates down my arm.
All right, on a scale of 1 to 10, 10 being the most pain you've ever had, and 0 being no pain at all, what would you say your pain is?
Like an 8.
All right, have you ever had this pain before?
Yes.
All right, and what happened with that pain?
I went to the doctor and they told me I was having a heart attack.
Okay, so by asking those questions, the last question I asked isn't on your paper, but it's a corresponding question related to OPQRST, so it forces the proctor to have to give me 2 more points. So I've gotten all the points so far. Next thing I'm going to do my sample history. So signs and symptoms, she's having chest pain. Do you have any allergies?
Penicillin.
All right, do you take any medications?
I'm on Metro.
Okay, do you have any past medical history aside from the heart attack? All right, have you had any recent stomach surgeries?
No.
All right, or any other surgeries for that matter. What was your last meal?
I had pasta.
Okay, and what were you doing when this pain started?
I was eating pasta.
All right, very good. So I'm going to call this, I feel safe that this is a cardiovascular patient. It's not respiratory or psych or anything else right now. I know that the organ affected in this is potentially her heart, and it's the cardiovascular system. So I'm going to have my partner take vital signs. Let's say he comes up with 110/70, pulse 98, respirations 18 non-labored. My interventions, so I'm going to call the doctor and convince him that I want to give the patient 324 milligrams of aspirin orally and up to 3 doses of nitro, each of them being 0.4 milligrams. I'm going to make sure I have the right patient, the right dose, right time, right route, and right date to make sure all those fit. I'm going to reassess my patient every 5 minutes, and my field impression of this patient, this is potentially a cardiovascular patient, possibly a heart attack that I would like to rule out. If my pain goes away a little bit after the 3 nitros, then I would probably diagnose this as an angina pectoris patient. But if the pain doesn't go away, I might think it's a heart attack. So I reassess my patient every 5 minutes, and I would give an accurate verbal handoff report.
Can we hear that?
What's that?
Can we hear that?
Say it one more time.
I would like to hear the verbal handoff report.
All right, sorry about that. All right, so Doc, here we have a 47-year-old female whose chief complains chest pain that she's had about for the last 20 minutes or so. States that the pain radiates down her left arm, states the pain is about an 8 on the pain scale. We didn't have any relief after a total of 1.2 milligrams of nitro, 3 doses. We also did give her the aspirin. She doesn't have any allergies except penicillin. We took her vital signs. Her vital signs remained stable the entire time. We also did put her on 2 liters of nasal cannula because her oxygen, she was a little bit hypoxic originally at 94%. And she also takes nitroglycerin. I made sure that it was the right patient and the 5 rights for it. And that's it.
Yeehaw!
All right.